Hi, I'm Dr. Amber from Treasure Coast Animal Rehab, where we are exclusively dedicated to mobility rehabilitation, pain management, and geriatric pet care. For Pet Pain Awareness Month, I wanted to talk about arthritis because it is the most common cause for joint pain and painful pets. So the big things to remember is arthritis is a word that we say a lot. We hear it a lot in our pets, we hear it a lot in people, and it has a couple different names. There's arthritis, there's degenerative joint disease, and there's arthrosis, which basically it is an inflammation in your joint space. This inflammation causes pain, and typically you move different, which causes more inflammation, which causes more pain, and you keep moving different. It's one of those cyclical effects. So about 25% of dogs over 1 year old have arthritis, which is a significant amount. The other one that's scary is 50% of dogs and cats that are between 5 and 10 years old have arthritis. And the scariest one is up to 20% of longevity can be lost due to pain and mobility problems related to arthritis. So the big things to remember are that all breeds can be affected, but mostly we see overweight large breed dogs. So we do know that keeping our dogs fit and trim can add up to 2 years of lifespan and can also delay onset of some of these diseases like arthritis by up to 2 years. So it is really important to have your pet at an appropriate weight, and we can go through body condition scoring on another day. There is a post on our YouTube page about how to do a body condition score. So the important things are that, we see a lot of pudgy pets on TV, we see a lot of pudgy pets in commercials and cartoons, and we think that that's how they should be, but you should easily be able to feel their ribs. They should have a tucked up waistline. We shouldn't feel pudge. We should feel bones when we touch our dogs. So that's the most important thing. Other than obesity, trauma, nutritional differences when they are little, if they were not on a complete and balanced diet growing up, conditioning of the pet. So if you have an athletic dog, the frequency of the exercise, the intensity, and the duration are all really important. And they can have immune-mediated diseases as well that can also affect these joint spaces. How do we diagnose arthritis? So there's a couple different ways. One is history. Again, if we know a dog who is overweight now, who had a bad nutritional upbringing, who was a very athletic dog, it's going to increase their chance of arthritis. But a history, the biggest one, and what we really focus on here at Treasure Coast Animal Rehab is the palpation skill. So we palpate every joint space. We do range of motion on all of the joints. We're feeling for heat, pain, swelling. We're comparing muscle mass on one limb to the other. We're measuring those muscle masses so we can tell if there is a size difference from one to the other. We're feeling for soreness and your pet's reaction. So palpation is the biggest thing. We can do x-rays, we can do ultrasounds of the surrounding muscles and ligaments and tendons to see how they're affected, and we can do CTs of joint spaces, but palpation skills are really, really important. And how do we treat arthritis? So there's a lot of stuff we can do. The biggest things are weight loss. So we know that getting weight off of an arthritic pet is going to make less load for those joints. It's also going to put them into an anti-inflammatory state for a period of time. So that's really important. We want to modulate these pains. So we can talk about NSAIDs. There are some other pain medications out there that make pain better, because what can happen is if you have pain in your knee and we don't treat it, and I see this a lot, especially with senior dogs, people are very afraid to put pets on chronic pain meds because they're worried about organ function. But the problem is if we don't treat the pain where it is locally, it becomes centralized, which basically means your spinal cord is so comfortable being in pain that it becomes a central pain disease, and then it's even harder to break. So, you've got to weigh your benefit to risk ratio. You've got to know your dog, and you've got to consult with your veterinarian on what's best for this. But there are very few circumstances where I will tell you to not give pain meds at all. We can usually find something that'll work for your pet to make them more comfortable, and that you're comfortable with giving, because that's the other important part. Other things we want to do is there are a variety of different supplements that are chondroprotective, so we're trying to protect the lining of these joints. Some are beautifully anti-inflammatory. Some of them can help improve the joint fluid in the spaces. So this is again where it's really important to consult with your veterinarian about what options are out there for your pet. Improving joint stability and mobility. So that's what we do a lot of here as well. So these are where your therapeutic exercises comes in, your manual therapies with range of motion. So when you think of moving your joints, if you think of any of your arthritic family members, they get up, they walk, they bike, they do things every day to keep their joints moving. I have a lot of people who stop exercising their dog because they're painful after, but the more we move, as long as it's safe and controlled, the better our joints are going to feel. So it is really important to keep them out and moving. And then things that we do here in-house is we can help work on joint capsule tightness, which is one of the reasons why you get restricted range of motion. We can help mobilize the bones in different ways to help loosen up these joint spaces to improve your range of motion. The better range of motion, the less pain, the better their walk's going to be, the better their gait's going to be, and the less compensatory injury. So again, back to those palpation skills. I'm not just feeling if you come in for lameness on your right rear, we're going to feel every single joint and muscle from your head, your nose to your tail to see if we can find any other sources of pain, because we have to fix all of those as well. It's not just, one and done and fix one space. So, arthritis is a very, very big topic. It's very overwhelming. So hopefully this was a nice overview for you. If you have any specific questions, please feel free to email us at info@tcanimalrehab.com. Follow our Facebook page or Instagram and subscribe. And if you have any questions, you can always call. Have a great day.